Hello, hi, Dr. Anthony. Mute, mute. I think your audio is
Mute, right?
mute.
Yeah. Hello, how are you?
Good, 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 good.
Yeah, I think I
Yes.
can see Dr. Anil is also
As a Dr.
in.
Anil also is there. Very good.
Yeah.
Chalo, first
Yes, sir,
class.
I have come, sir.
Chalo, let's start. So, of course, this case is amazing. This case, whenever we take this up as a discussion, will be a fantastic case to discuss. But what I'm going to take up today, no, 1 minute. Lord, my back. Yes. So what I'm going to take up today is start to end in how much time we finish an entire planning. Okay, and in that process,
Yeah.
what all we go through. So just before we begin, just to get an idea, this is what we started with. I'm certain at least 70% of dentists, if they see this case, they would tell the patient, no, this can't be done with aligners.
True, sir. When I saw this case first time, I actually wondered how did you achieve that result in with
And
aligners?
honestly, we have not used any auxiliaries as yet. No buttons, no micro implants, nothing. Everything has been purely aligners right now. So very quickly, I will just walk you through the process. At some stage, no, we will take this up. I'm thinking when I finish the entire case, no, that will be a good time to actually sit for like 2 hours to understand how each stage was planned for this case. How many months did it last and what was planned, what selective staging we did, lot of stuff. Essay. So this was at so this was maybe July and this was December when we did the second scan. Then this is April when we are creating space. Can you see we are creating space for the lateral now? And this is right now where the lateral is totally moved into the space and there is nice space left enough over here. So now we are going to do even better correction where we will get, now the target is to get this canine in position, settle the bite little more, and maybe incorporate some amount of IPR. Unfortunately, this patient has her boards which are starting in just a few days. Otherwise, this patient is highly due for a oral prophylaxis session, a cleanup, and honestly, I would have done IPR to begin with and then only taken the scan in the lowers to settle the bite also a little bit better. Okay, let's start. Till that time, also I would want to change this to a vertical attachment, which I can't do now because now the patient does not have time to come to the practice. So it's okay. We will manage right now, just a matter of 1 or 2 months. So my initial planning that I will do from the point of view that, okay, I'm going to do this for about 1.5 months or about 7, 8 aligners I want to plan for 2 months. Patient can just continue with the current attachments and then I get the patient back in, do the oral prophylaxis, do the lower IPR, and then get better, overjet adjustments and stuff like that. So while it is loading, let's evaluate what chalo, it's done. Let's move further. So it is 9:58 that we have started this case. Let's see as a routine in how much time we finish this case. So this is all the time that it should take, honestly, to prepare your model from a scan into a 3D printable model. That's it. 1 minute, it's actually 9:58, so not even a full minute. Okay, you all can unmute yourself and you all can keep revising the steps. Step 1, mark 1-6,
Occlusal plane.
1121 and 2-6. Press
2,
next.
6. Yeah.
Midline.
Get the,
Midline.
yes, scan in the way you want to view. Click in the center, hit next. So now I have the auto segmentation on. So it's going to detect everything on its own. It's going to segment everything on its own and get it ready for us. See, it's marked the mesial distal on its own.
Yeah.
So we'll have some compensatory correction where with this time we will try and get the upper premolars slightly inclined palatally and the lower opened up, buccally. A compensatory process to get better interdigitation. Same things happening for lower. The lower arch actually looks pretty good.
Yeah. What was the chief complaint of the patient? He just wanted to
Crowding.
correct the canine.
Crowding, doc.
was it?
Crowding. Upper crowding was the chief complaint of the patient. Patient is a young girl in 10th. So the patient is about 14, 15 years old. So a lot of times we all have, that a stereotypical mindset that no, young patients are not compliant. We should not do aligners for 14-year-old, 15-year-old patients and stuff like that. I can show you so many cases, so well compliant. Like imagine if you could get the patient till here, what more does the patient wants?
Yeah.
Just wearing aligners, nothing. I'm not saying it's perfect. There is still a long way to go with the bite, with the overjet, with alignment of the upper arch form, everything. Okay, what are the
So
4
till now,
steps?
how many aligners has she worn?
I don't remember. We can check that. So
But it's almost like 7, more
no,
than
it's almost a
8 or
year.
9
No,
months.
it's almost a
Year,
year.
almost a year. Yeah.
Year. But
It's
ऐसा नहीं,
12
this
months.
patient used to wear more aligners. मतलब aligners, same aligners for 10, 12 days also.
Oh, okay, like that.
Which is good for us. Like I am happy, when my patient wears, till the time they are wearing the aligners, I'm happy. So as I told you that the patient is for the lowers, if you notice the lowers right now, my thought process is going to be that the alignment is fair. Like it's not perfect, but it's fair. It is fairly acceptable. So honestly speaking, unless I do, the only primary thing that I have to do for lower is IPR.
Yeah.
To get better overjet, over here.
Yeah.
I want
Correct.
better overjets for this case. So that's definitely there. But the patient can't come in at least till the mid-March or something, till the time the boards get over. So what I'm thinking is I will not touch the lowers right now. I will tell her you continue the existing lower, or I will just make one passive lower aligner right now, which she continues. And I will only do the upper planning, which I can achieve with the current set of, attachments. So if I want to have this canine to tip mesially, okay, I need to have a nice vertical attachments to have fair
Vertical.
control. Now the patient is not going to come in right now. So what I'm going to do is I'm going to, in that much time, I will try and extrude. For extrusion, a horizontal attachment is perfect.
Yeah.
Correct? So let's do one thing, that let's get the lateral little more, buckle. Let's overcorrect that part little bit. So when I move this like this, I am forcing the aligner to actually maintain the torque as much as possible, because this horizontal attachment is not going to allow it to just tip like this. It's going to lock this position and then make it move like this.
Okay.
Getting? So let's
Yeah.
move this. See, now the cervical looks so well. Let me undo this. See, depressed cervical over here. The cervical is looking much better, over yours. And when I move more buccal, eventually I am going to gain more space. So I'm going to overcorrect this a little. Okay? So that I eventually have more space for the canine also.
Doc, when you are moving, when you are translating that buccally, do you look at the collision marks to see whether it is going beyond a certain point?
See, I don't want any collision marks.
If it is red, especially.
Yes, I don't want any 0.1 and anything above that. I don't want it.
Yes, sir.
So let's now. I want to at least give it a shot. जितना होएगा उतना ठीक है, जितना नहीं हुआ, it's okay. I don't want collision anywhere. I want that there should be no collision on either sides, and I will try and extrude this. Okay. Now, what is my extrusion value? Let's check. Because how many aligners I want to finish in this plan? 4 to 8 aligners approximately. Extrusion is 1 millimeter. Okay. That means 4 aligners. Correct?
Yeah.
तो इतना करता हूं इसको, and this canine looks okay. है ना? This canine looks okay. Let's give it little bit of rotation also. कितना rotation आया? In 8 aligners, how many degrees of rotation can I do? Maximum 12. So I want to restrict myself in 10 degree rotation. See, I am at 10 degrees right now. See, 10 degrees. Okay. So if I go to divide sub setup right now, 8 aligners. Can you see how predictable calculation helps you achieve the desired number of aligners?
Sir.
Okay. So let's see. Now, if I want to move this lateral, I want these two centrals to be selective anchorage. If I want to move this canine, I want this premolar to be selective anchorage. I don't want them to move at all. Okay. Let's check the bite. From the bite perspective, this molar is in cross bite. So I'm going to take a decision whether I really want to shift it, or if the cusp fossa relationship would be okay, then I would leave it in cross bite. One single molar, rather than trying to fix that single molar to correct. Getting what I'm saying?
Yes, sir.
Doc, we can't try some buccal tilting of these posteriors?
Upper or lower?
The upper. That means 2.4, 2.5 and 2.6. So it will be like some expansion.
Can you appreciate that 2.4, 2.5, the cusp to fossa relationship is beautiful. Anything if I move buccal, now I will have cusp to cusp hitting. Can you appreciate?
Yeah, correct. Yeah, it
So
will be like
I have already corrected this quite a bit. Can you see how beautifully the cusp fossa relationship is? See, there is posterior, open bite or deepening of the bite as a result of the aligners. So let's move this premolar, because I think we can benefit, little bit of movement over here.
Little bit,
है ना? Now, when the patient comes in, I want to do some IPR distally. I have so much enamel that I can use over here.
Yeah.
When I remove that constraint, it will allow me to move this premolar slightly and create some space for this premolar to extrude.
Yeah, correct.
I want this premolar to actually extrude. So in this much space, I'm going to try that if at all it can. थोड़ा movement डाल के रखता हूँ, क्या है ऐसे. So I'm going to try and extrude little bit, to a millimeter, because that much I can achieve in 8 aligners. Okay, so now see, I have an section of 0.11, which I'm not happy with.
Yeah, correct.
Okay, so I want that simultaneously I will move this premolar also, if possible, derotate little bit. But then that is creating an IPR over here. So let's try and move this also a little bit. Okay, manageable. All right, and let me give little, no. If I extrude more, no, I need to do IPR because there is going to be a constraint. So what happens, no, in your initial phases, when you control the production, no, you're not worried that, okay, I'm going to waste 8 aligners and I will only do 1, 2, and 3 teeth movement. Why? Because when you start doing these cases, that's the only time you're going to realize that, okay, are these movements doable, not doable, stuff like that. I'm thinking, how about I distill out this central slightly? What do you guys think?
Distallize the central. Midline
No, distill out it.
Distal out. Yeah.
Distal out, yeah.
Distal,
And we'll
yes.
benefit little bit, I think, if it distill outs like this.
Yeah, correct. Yeah, it looks better actually.
Yes.
From this.
And maybe little buckle.
Yes.
So I'm going to leave
So,
it
Doc,
in future, just 1 minute. In future, when I'm doing my finishing, no, maybe I will mesial or distal in this. Or maybe make this like fully derotate slightly, like this, just slightly. Yes, Doc.
Yeah, that, like when we are doing the buccal and lingual movements, is there is it like only 0.25 millimeters we should stick to, or is there like you are sticking only to
Are you
that
talking
limit,
about
or you
this parameter, or are you talking about me moving it while planning?
No, while you are moving it, like, do you have any restriction on that? Like,
no, there is no
you can
restriction.
move as much
as you.
Because other part it already gets divided, no, into that whatever we have said.
So now by me derotating this central incisor, 1 minute, Dr. Anil, by me derotating this central incisor, I have created space for this lateral. I'm thinking, why not squeeze this here slightly to create little more space for the canine over here? See?
Yeah.
Now we will end up with no intersection. Yes, Dr. Anil, you were saying something.
Sir, what is that proximal value which if you cross that you have to do IPR? What is that value, sir? I forgot.
0.15.
0.15.
0.15. Okay.
Yes, 0.15.
We should restrict ourselves to less than 0.15.
Less than 0.15.
If you want to avoid.
But see, ऐसा नहीं, ऐसा hard and fast rule नहीं है. You understand the rule properly. 0.15 in digital world is considered as a tight contact. Tight. Okay? Floss. Tight contact. But abhi, I want to extrude this canine. I want to extrude this premolar. इसमें 0.15 रहेगा ना, it will not move. It will not extrude. So if you can't reduce that value on the software, you need to go in and pass an IPR strip over there.
Okay.
No IPR gauge or anything is needed. सिर्फ strip pass कर दो बस.
So, sir, आप वो कैसे measure करते हो कि इतना IPR उस समय करना पड़ेगा? Like, you just look at the limit here and then do it?
See, कैसा है? Let's check the video of this. Let's see whatever we have planned right now. Is it intersecting more or no? See, when you're creating videos, now I have moved 1, 2, 3, and 4 teeth. So all I'm going to do is zoom in so that I only am going to focus on these teeth and create video, create animation. Superb. There are no interactions between the scans, no constraints. So no contacts are going to be tight, which is going to restrict the desired movement.
Yeah.
Okay.
Okay. So honestly speaking, for this case of mine, I would end here. Why? Because I want to change, or I want to tip this mesial in, or actually I want to change the torque, the root distally for this canine.
Yes, sir.
But for that, I need a very strong vertical attachment over here.
Yeah.
Which I can't put because the patient's mother is going to come and collect the aligners and go.
Okay.
Okay, so I'm going to restrict myself. So if we notice now, let's see, what did we start with? We started with, so we have extruded this canine, tipped it mesially. Okay, we have moved the lateral more buccally, derotated it slightly, derotated the central slightly, and derotated this, and extruded this premolar. This one. See the attachment from year to year we have extruded.
Yeah.
Okay. Yeah. So for now, I'm going to call this as my rename setup, and I will call this phase 4.1. Whenever I scan and I start planning, I change my phase. So since I'm going to have time, 9:58 we started, 10:15 we are done over here. Okay, we are done with this. So I'm going to go back and I will now discuss this case with you guys. Okay. So in the meanwhile, what is the next step? I'm done with my planning. What is my next step?
You have to save it.
Okay. Awesome. That's one of the
subdivide setups.
Yes, Dr. Anil?
Subdivide setups.
Perfect. Saving खत्म करने देते हैं उसको. Save खत्म हुआ. Go. 8 aligners. I'm happy. Subdivide setups. See, now in this, no, only upper is going to happen.
Yes.
Lower, I've done no movement. So I have saved the number of aligners in lowers in this right now. और मेरे patient का boards भी handle हो गया और time भी waste नहीं हुआ. Getting me?
Yes, sir. Yeah.
So I don't have to do any staging. I'm so sorry. So I go to export. Okay, something is wrong because it's not showing. It happens sometimes. When that happens, what I have seen is you close this window, save. Okay, reopen the case.
Doc, ये जो attachments जो होता है, like because we have the shape molding, that thing happening. Even if attachments is little bit, like suppose we are not able to put the vertical attachment or something, but you will get the movement to
70-80% will happen.
It is depending on the shape molding.
Yes.
What do you call that? The
shape molding effect.
Shape molding effect.
So let's call this phase 4.1. Patient's name and sub setup number. Okay. Molars, I want it on 7s. That's perfect. Both the jaws. And I'm going to hit export. Okay. Now let this export. It will take about 7-8 minutes. Till that time, let's evaluate the case. Okay.
Sir, Doc, for exporting, you clicked right and then exported, isn't it? Against the patient's name.
No, I clicked this.
Where?
I clicked here.
वहां पे राइट
Let's
क्लिक
vote.
किया आपने?
नहीं, normal left click. There is no right click anywhere.
Oh, that okay, yeah, that is the emblem. Sorry, I keep forgetting.
There is no
Oh,
right
sorry
click.
for that.
किधर भी use
Yeah,
नहीं
yeah,
है.
got it.
Now, let's see phase number 3. Okay?
Yeah.
Because you have
सर
seen the
अभी
current
एक्सपोर्ट किया तो
scenario,
अभी
no?
सिर्फ अपर मॉडल ही आप करने वाले हो ना प्रिंट?
हाँ, only upper I will print and give it to the patient.
ओके.
So now, for example, even though patient का treatment is still remaining, my full payment is done.
हाँ, yes sir.
Getting my point? In spite of giving the patient the liberty to pay 20,000 per month, whatever the charges for the case would be, that is done already. And the treatment continues. So the whole idea is, do not give the patient that luxury that, okay, treatment is not finished. हाँ तो आप 5,000 बाद में pay कर. Nothing. Okay, so see, if you notice now, I have two phases, phase 3.1, phase 3.2. If I click on phase 3.1, let's see what was happening. It only had 5 aligners. Okay, so what was happening in phase 3.1? So this is my malocclusion. Okay, this is before and this is after. Basically, the centrals are moving away to create space for my lateral incisor. Did you understand?
Yes,
So
sir.
this is not staging. This is phasing. Phasing is a process where you are not doing distribution within a plan, but you are dividing the plan only altogether. So after these 5 aligners, what I would do is, let's go to 3.2. So now in phase 3.1, what was happening? These two centrals are moving out to create more space. And in 3.2, let's go to malocclusion of 3.2. Did you see? Sirf this lateral. In 3.2, only the lateral is moving out.
Yes.
See the collision value. Sorry. No collision. That's why the lateral tracks so beautifully.
Yes,
so
sir.
now this is what we ended our plan, correct? Hannah, this is what we ended it. Let me take a screenshot for you. Snipping. Okay, so now let me shut this and I want you guys to see the current plan. Let's take a screenshot of this too. Okay, I have 10 minutes remaining now. The meeting will end after that. Okay, let's open 1 and 2. See, this side is what?
Yeah, that's the phase 3.
Yeah, but this is my virtual plan.
Yeah.
This is my final outcome.
Okay.
How much do you think it tracked?
Yeah, it's quite good.
Absolutely same.
Huh? Almost 90% or 90+% it has tracked.
Yes.
This is what I'm talking about. When you design a case, if you actually put in, some more thought into small things of the biomechanics, but not only biomechanics of orthodontics, but how aligners are going to work, how things are going to happen. When you add like 10, 15, 20 aligners to your therapy, for that patient extra, by dividing it into phases. So from 3.1 phase, which was only these two moving, to 3.2 phase, I did not scan in between. But after 5 aligners, the patient comes inside the clinic and you check, is the tracking okay? If the tracking is okay, then you would go to the planning, and then now you would just add a new setup and you will start from the 5th aligner. Okay?
Okay.
Dr. Anthony and Dr. Anil, this is a negative attachment.
Yes.
See,
Yeah, for derotation.
this is negative attachment. What I will do, let me show, if I can, how it looks on a real model. 3 point. This is 2.1. Phase 1. Okay, let's see a 3.2. Let me open any model. Maxilla. Can you appreciate the negative attachment?
Yes, sir. It's a depression.
Depression. That is why.
How
Can you
how do you
appreciate?
get this negative? Yeah, I can see it.
So by adding a normal attachment as a negative attachment, but no, it's very risky. Getting my point? Honestly speaking, it's not balanced also.
Yeah.
So in my case, I know what the odds are. One,
Yes, sir.
that if it doesn't fit, I will throw, I will discard, I will create a new one. Because everything, as I explained to you guys in the course, for me, everything is an experiment. If it works,
Yes,
super.
sir.
If it doesn't work, I am happy with that also. So, but honestly speaking, you should be very, very careful when you're doing this. I wouldn't recommend you guys to add negative attachment in your first 20 cases, because there is a very high possibility that the aligner will just not fit if your negative attachment is off.
Yes, sir.
Doc, how do you insert that? Like in the software,
insert
is
करना ही
there
नहीं
a
रहता है. You see
facility?
this. Insert करना ही नहीं रहता है. It's basically like a positive attachment only. See, in the plan, the software makes it a depression.
How does the software make it a depression? I tried a lot, but I couldn't figure it out.
मतलब don't stress on it right now. I'm telling
Can
you.
can we use the pliers for that? Like in certain
That's what I
cases,
told you, that I would recommend you that initially, you just use pliers. Do not try to use anything else. Negative attachment for sure, and you already have pliers. What happens is you can do a ditch in one, what do you say, one aligner, check, and then proceed further. And the negative attachment, or the dimple as they call it, that comes from the plier, is a very controlled dimple. That is ideal. But in the software, if you like miscalculate, it'll come wrong. So I have done those negative attachments from the sake of experimentation.
Hmm.
Okay, so can you see how beautifully it waxes up?
Yes.
Okay, let's check. My hollowing is done and my drain holes are also ready. Next, save. I am done.
So can you again show wax up?
अभी गया वो. Just save करके मैंने बंद किया. खुला है क्या?
सर अभी इसमें ये केस में कितनी बार आपने स्कैन किया?
One more thing, just remember, अभी कैसे I close that, no? You can't get the wax up again. Okay, it will only pop up if you go through the entire exporting procedure again. Wait for another 10 minutes, तभी आएगा वो. It will not come before that, unfortunately. हाँ, क्या बोले? कौन बोला?
सर आपने कितनी बार स्कैन किया ये केस में?
मैंने
स्टार्टिंग से
केस को, चलो आई कैन गिव यू, बट आई हर एक को खुलना पड़ेगा ना. 2 मिनट बाकी है. आई वन फर्स्ट स्कैन. दिस इज पेशेंट्स फर्स्ट स्कैन. दिस इज पेशेंट्स सेकंड स्कैन.
बराबर.
This is patient's third scan, and this is right now patient's fourth scan. So ideally, first scan तो you will always have to take, right?
हाँ बिल्कुल.
And in between there have been 3 scans.
तो सर बीच में एक जगह तो आपने बोला कि अगर ट्रैकिंग फिफ्थ अलाइनर पे परफेक्ट है तो आई विल कंटिन्यू इन द सॉफ्टवेयर ओनली फैब्रिकेशन फॉर फर्दर अलाइनर्स.
इधर दिखाया ना
तो
मैंने
कहाँ पे आप
3.1 और
डिसाइड करते हो?
3.2. I showed you 3.1
तो
और
कहाँ पे आप डिसाइड करते हो कि स्कैन करना है या नहीं करना है?
I'll decide on the fifth aligner कि fitting perfect है, tracking is okay, you know. Now I will move further.
Okay. और जब भी आप वापस स्कैन करते हो तो शुड द अटैचमेंट्स बी रिमूव्ड एंड स्कैन?
No, never. Why would you want to do that? Never.
Okay.
Never. In fact, जो भी excess है, everything will become a part of your scan. So you're not worried about any excesses also. That's why I've not removed the excess. Because from my second scan onwards, all the excess are also a part of my scan.
Okay.
Yes.
Yes.
But if you notice, you know, just by, you know, smart, there is no IPR for this case up till now. I have not done any IPR, the entire space creation, you know, all the way from here. यहां से इसको ऐसे खुला रखते हैं, छोटा सा ऐसे नहीं, ऐसे रखता हूं. कहां गया अभी का?
सर 20-25 सेट्स तो हो गया होगा ना अलाइनर्स का ये पेशेंट को पहनते हुए?
20-25 नहीं, ज्यादा हो गया होगा.
डॉक, ये जो आईपीआर आप करते हो, आप वो एनालिसिस करके आईपीआर करते हो या और व्हेन वी आर डूइंग इन द सॉफ्टवेयर यू जस्ट लेग इट आउट? कैसे आप?
I will take that up properly and explain, Dr. Anthony.
Okay.
अपने लिस्ट में है वो. We have to, you know, पर कैसे थोड़ा सा और, you know, mature level, मतलब ऐसे just waiting for that slightly. इसको थोड़ा सा ये करता हूं. 1 minute is remaining. It will close anytime. See from year to year. How bad is this? No IPR, nothing. Pure aligners.
Big difference.
है ना?